Hello everyone, my name is Chatrione Harris and I am the instructor for Learn Medical Coding, and I'm coming to you with some information that I think is important. Now, if you cannot remember the name Chatrione, remember the name Sean. Okay? Alright, so we're going to go over something that's very important, one of the first steps you're going to have to learn when coding for ICD 10CM. Without knowing how to identify the main term and the subterm, your coding process will probably take forever and it probably will lead you to the wrong places and to the wrong codes. So we're going to go over this information right now. So let's get started. Okay, so the first step to actually finding codes in your ICD 10CM book, of course, again, is identifying what your main term is and knowing what your subterm is. Once you can identify what they are, you will be able to look up your ICD-10 codes in your alphabetic index. So let's start with the example that I have on the screen. So we have example number 1 for bipolar disorder. One thing that you will realize when you get into coding, that a lot of times if you're looking at a diagnosis that ends with the term disease, disorder, or syndrome, those terms will be your main term. So, for example, bipolar disorder, your main term is disorder. For epidemic disease, your main term is disease. Also, when identifying the main term, you will find out that you will never look up a diagnosis based off of the anatomic site, like the leg, the arm, the elbow. You always look up what's wrong with it, the condition of it. Is there a problem with it? Like if, for example, a patient comes in with a fracture of the arm. Fracture is what's wrong with the arm. So your main term would be fracture and your subterm would be arm. So now let me explain what subterms are. Subterms basically further specifies and give more information about that main term. It tells you more information. And here's the definitions that I have for you. Main term is located in the ICD 10CM index. They are bold-faced and listed in alphabetic order with subterms and qualifiers indented under them. And then you'll find subterms that qualifies the main term by listing alternative sites, etiology, or clinical status. It is indented 2 spaces under the main term and usually starts with a lowercase letter. So I have an example right here for abdominal pain. Your main term is pain, okay? The type of pain the patient is having is your subterm. So you will look up your main term, pain, which is, again, if you look at that main term, this is how it looks in your ICD-10 book. The pain is bolded with a capital P at the beginning. And as you can see, the subterm is indented under the main term. And it's a lowercase letter and it's not bolded. Now let's practice. Okay, so for acute appendicitis, I want you guys to also know that acute and chronic are never main terms. Okay, they are never your main terms. They're always either subterms or non-essential modifiers, which are basically non-essential modifiers will be found in parentheses next to the main term. And basically, non-essential modifiers do not change the code. It just give additional information that may be available for that code in the documentation. It may or may not be there, but it just lets you know that this information is included in this particular code. So for acute appendicitis, your main term is, if you said appendicitis, you are correct. For neonatal hypoglycemia, when you're looking at this term, you may be a little confused of what your main term would be. But what you always have to realize is what's wrong with the patient is what your main term is going to be. And in this situation, what's wrong with this patient is that this patient has hypoglycemia. But what type of patient has hypoglycemia is going to be a subterm. So in this case, hypoglycemia is your main term and neonatal is your subterm. Cystic fibrosis. This patient has fibrosis. That's your main term. The type of fibrosis this patient has is cystic. So your main term is fibrosis. Fracture of the tibia. What's wrong with the tibia? It's fractured. So your main term will be fracture and your subterm will be tibia. Dislocation of the shoulder. What do you think it is? I hope you said dislocation. It's what's wrong with the shoulder. Bipolar disorder, which was something that we had, talked about a little earlier. And I said it before. A lot of times, if you're looking at a diagnosis and it ends with the term disorder, disease, or syndrome, that's the term you're going to look up, that disease, disorder, or syndrome. So in this case, you will look up disorder, and then bipolar would be your subterm. So main term disorder, subterm is bipolar. And we're going to stop there. If you guys have any questions for me, please feel free to contact me at charris@learnmedicalcoding.com. I thank you for your time. Have a great evening.